Okay, today we're going to be doing my Foley catheter insertion validation. So first we're just going to scan the room that there's nothing on the walls or anything. And also my patient chart. Here we have Martha Sanford. She is admitted for a pre-op femoral popliteal bypass tomorrow. And looks like she's had a few other past medical surgeries, left knee replacement, hysterectomy, gallbladder removal. So she might have had a catheter before, but we'll make sure to clarify with her. She has no known allergies. And then also her vitals look good right now, good SpO2. And also she has a standing order due now for a urinary catheter insertion. So we're just gonna go talk to her, see how she's feeling about this, and then we will get this all set up and ready. So I'm gonna make sure to knock. Hi, my name's Samantha. I'm gonna be your student nurse today. I see that you have, can I get you to verify your name and date of birth?
Martha Stanford, 11/12/41.
Awesome. So Martha, I see you have an order for a Foley catheter insertion. So I just wanted to come and ask you, first off, do you have any allergies you know of, like to any shellfish or iodine?
Nope, no allergies.
Okay. And have you ever had a catheter before, from your knowledge?
I think I may have from a past surgery.
Okay. And do you know how you reacted to that? Did you get any UTIs from that or anything afterwards, or any infections?
Nope, no complications that I know of.
So I'm just raising the bed. I'm going to just take a look at everything down there and see how you're looking before we insert the catheter. Is that okay with you if I remove your covers and take a look?
Yeah, I'm just a little anxious. Is this gonna hurt a lot?
It shouldn't hurt. It might be kind of discomfortable just because we're going to be inserting something into your urethra, but everyone's different. It kind of just depends on how sensitive you are down there. For some people it doesn't hurt at all. Some people it kind of burns a little bit. So you might feel a little bit of that, but besides, it's not guaranteed though.
Okay.
No pain, like no excruciating pain or anything.
Okay.
Okay, so I have my privacy provided. I'm just gonna remove her sheets now and take a look. Okay, so she does have female anatomy, everything like that. So we will be doing a female catheter insertion. And then I'm also going to delegate a CNA to do just some prenatal care on her. So now that that has been done, while I'm still in here, I'm just gonna get her repositioned and stuff, because once I come back and have my sterile gloves, I can't be touching her skin and anything like that. I'm just gonna reposition your legs so it'll be easier when we insert the catheter. Sound good?
Yeah.
Okay. Okay, so I have her positioned. I will just cover you up as much as I can, leaving that part exposed since we will be putting our sterile work field there. And that's not uncomfortable in your legs or anything, is it?
Nope.
Okay, so I'm just gonna lower the bed rail, bring my supplies in, and then we will raise it so we can start our workspace. I got the call light in place. Okay, Martha, I'm gonna go grab the supplies and I'll be right back.
Okay.
Okay.
Now we're inserted there.
Knock, knock. Hi, Martha, I'm back. I just have my supplies now to do your catheter insertion. I'll be doing my workspace over here. Can I get you to verify your name and date of birth?
Martha Stanford, 11/12/41.
Awesome. I'm just gonna go do some hand hygiene here real quick. There's no sanitizer over there. Okay, we're gonna do some hand hygiene, and I will get my sterile field set up and my gloves on. But first, I'm also going to raise your bed to a comfortable working space. Okay, that should be a good work height for me. Okay, and I'll let you know before I do anything down there so there's no surprises.
Okay.
I'm gonna open it up. I have a 14 French catheter kit. It's not expired, no tampering with the package. I'm gonna take it out. And I'm going to just be grabbing the outer corners and opening away from me to start. And I'm just going to be making sure I maintain sterility of it, make sure it's nice and open. Okay, so I have my sterile work field over here. I'm going to do my glove donning over here. Okay, so I have my sterile gloves. I'm going to open over here making sure they maintain sterileness. Okay, now I'm going to start with my non-dominant hand touching the inner rolled cuff of the glove because that part is not considered going to be sterile. I'm making sure not to touch any of the outer part of the glove. Find our little thumb hole in there somewhere. Okay, I'm going to leave my cuffs to roll. Once I have my glove on, I will put it under on the sterile part of the glove. Now I'm going to take this glove and put it under the cuff because that part is considered sterile. Making sure I'm not touching it on the sterile part of the glove. I'm just going to roll that over my dominant hand. I can touch that part, that is sterile. Just me being dumb. Okay, and I'm just going to put my hand in the sterile part of the glove with the sterile part, roll the cuffs down. Have my sterile gloves on. Just going to throw this on the ground, touching where it was left sterile, so it's not on my work field. Next, I am going to take my drape that I'm putting on the bed, and I'm going to put the shiny side down, roll it over my arms, making sure I'm not touching any part that needs to be sterile. And roll my hands into that, like so. Okay, Martha, I'm just going to put this barrier down underneath you. Making sure I didn't touch any of her skin. Okay. And then I'm also going to be taking this drape and draping this over her just to kind of give her some coverage and only expose what needs to be covered. Okay. Now I'm going to get my supplies ready. I will clean her in a second here. Just get that opened.
I'll put mine right here.
Staying within my 2-inch sterile field.
Then bring my bed back up for me. I'm just going to reassess.
I'm opening my lube packet now.
Good. Just double check that was urine return. Good. All right, Martha. That is good. Let me know if you need anything else, okay? Okay. And then again, I put the bed all the way down.
And I'm also just going to take this and connect my syringe to fill up the 5 milliliter balloon. That's what the kit said. We're gonna connect that so it's easier when we already inserted.
Honestly, I'm gonna throw these away.
Okay. So I have that ready. I will lube up the catheter next. Making sure this didn't touch anything besides the sterile field. We're just lubing this so it's more comfortable when we insert it. And then when I clean her, I will be using my left non-dominant hand as my hand that I will be touching her labia majora with during the cleaning. So I have that lubed. Now I'm going to go clean her, and once I clean her, this hand will not be sterile, but my right hand will remain sterile. Okay, Martha, I'm just going to clean you now, just so you know this may be a little cold, but it shouldn't be uncomfortable.
Okay.
So I'm going to do outside, front to back. Front to back. And then front or down the middle to the back. Okay, now this hand is sterile, this hand's dirty, we will not be using this hand. I'm just going to go get this placed up here. That does not touch anything, so now I'm going to use my dirty hand, hold her meatus or her labia majora open, Just so you know, Martha, this might feel a little pressure. I'm about to insert the catheter, and I will insert it 2 to 3 inches or until I get urinary flow through the catheter, and then I'll proceed another 2 inches. And now, okay, I've had urinary feedback. I will insert and fill up the balloon.
Get you ready for your surgery tomorrow. So you want me to get up to the back.
This is a 5 milliliter balloon, so we'll do 5 milliliters of fluid. Okay, now that that's been in, the sterility it's not as much of a concern, so we're just gonna disconnect this.
I'll have some glue to insert it in there.
Discard that, and then I will take this catheter out of the bag now. And if this kit did include a leg restraint thing, we would put that on her leg, but it doesn't have one, so we're just gonna hang it on the bed. I'm just gonna change my gloves here quick because these are kind of looby, and then we'll get that set up.
Wrap in a prison.
How did that feel, Martha? Did it hurt, or was it not too bad, or?
It was not as bad as I thought it was gonna be.
Okay, that's good, that's good.
Okay, knock down.
We'll get you comfortable in a safe position. I'll come back and check on you and just see how you're doing with that. So this I would strap to her leg with this tubing, but we don't have that, so we would just hang this on the bed rail down here, and just making sure that there is no kinking or anything in the tubing. Get her in a comfortable position. Since this isn't secure, it does slide out, but the balloon has been filled, so it's secured in her urethra. Just gonna cover you back up, lower your bed, put it in a comfortable position. You got your call light in place. Okay, Martha. I'll be back in 15 minutes. Just check on you, see how you're doing with that.
Okay.
Sounds good. Okay. I'd also document the type of catheter I put in, how much I put into the balloon, how she tolerated it, the color and consistency of the urine that came out, and the output, like how much urine came out in her charts. Okay, it's been 15 minutes. Hi, Martha. I'm back. How you feeling?
I'm feeling good.
Good. I'm just going to look and make sure the catheter's still in place, isn't kinked, and you should be good. All ready for your surgery tomorrow.
Okay, thank you.
Yeah, I'll show mine too. I'll get that next time.
Just going to raise the bed rail again. Okay, I'm just gonna check. There is no kinking in the tubing, and I'm tracing it back. It is still in her urethra. Okay, awesome, Martha. Everything looks like it's still intact. You're still doing okay?
Yep, I'm doing okay.
Great, okay.
And then I'm gonna start.
Well, your call light's in place. I'll put your bed in a comfortable position and let me know if you need anything.
Okay, thank you.
Great. Throw these away. Arm hand hygiene. And that should be all for the Foley insertion validation.